The Ministry of Health's Pied Piper approach to communication is not appropriate in a post-pandemic world, writes Rachel Smalley this week. And Rachel, that's quite a phrase you're using. Look, you're referring to an initiative that the nurses came up with here. Look, just tell us a bit about that.
So what it references is a proposal that went forward to government to train more nurse practitioners. And a nurse practitioner is in all but name a GP to a certain degree. They can refer people to hospital. They can refer people to specialists. They can book in biopsies. They can do the full episode of care when you've got issues where you might need antibiotics or you might need a wound dressing. You might have an issue that's to do with dermatology or what have you. So they step in and do a lot of the work that a GP can do. So they're a really useful addition in a primary health environment. And the nurses collectively came together, the nurse academics, the nurse trainers, if you like, to propose to the government that at the moment we're only training fewer than 100, and they want to double that to 200. So the nursing colleges all walked side by side and collectively put forward this proposal through Professor Jenny Carrier to the ministry, to Health New Zealand, about some additional funding. And we're talking about maybe around $5 million, not a huge amount. And crucially, if we were to up the number of nurse practitioners, we could almost start immediately. We've got all the facilities there. We just need to provide some of the funding. So that was the proposal that went up initially to Health NZ, but seems to have found its way into the Ministry of Health and was pushed back by the ministry, which seems in the current climate to be a ludicrous response.
Yeah, so what you're saying here is, during the pandemic, it was all Ashley Bloomfield and Jacinda Ardern, follow us. And now you're saying they really need to start listening to other people who are coming up with some quite good initiatives to solve some of the problems we're facing.
Yeah, the Pied Piper references really the response to COVID in 2020, from March 2020 on. And Ashley Bloomfield and Jacinda Ardern very much were the Pied Pipers. They led from the front. They made all the decisions for us. And, we're a compliant nation, we're a compliant race, Kiwis, and we followed on behind. And that was fit for purpose at the time. But I think the ministries and the government are still suffering from what I call that Pied Piper approach, believing they have to have all the answers and they have to come up with all the ideas and they have to direct the nation. Whereas now, in a post-pandemic world, what they do need to do is engage the experts and listen to the people who are on the front line or who have solutions and have ideas. The response from the ministry is exactly how I would have expected them to respond when people were coming forward in the early days of COVID. It was, we've got this, we're working on our workforce at the moment over the next couple of years, and it was immediately dismissed. And Professor Jenny Carrier is very, very experienced. At the very least, Maria, I think they should have booked her in for a Zoom or a coffee or a chat on this issue.
Yes, well, that's the thing, isn't it? It seems like such a simple yet cunning plan, really, and you would hope perhaps that we're going to have a bit more joy with Health New Zealand. I mean, I met Margie Apa the other day. She's impressive. What are your hopes here?
Yeah, she is, absolutely. She's impressive. And let's just take a step back for a moment. What she is facing, trying to move this beheathen, all of these DHBs into Health NZ and make it more of a centralised approach, and all of the challenges that she will face with that within the system that's already it's overwhelmed at the moment. It's under-resourced. There's poor management in there. She's got a huge amount on her plate. So what I do think is insightful and perhaps a sign of hope is that Margie Apa, when she heard about this, did reach out to Jenny Carrier and said, look, we're looking at this. Let's have a conversation. It's still on the table. So that I thought was a response which was, she communicated that well. But I think from the ministry, who initially responded, that's very much the way they were communicating of yesteryear. It's a poor approach to not listen, to not engage experts, and to think that they have all the answers. I think one of the key things too with this proposal, Maria, is that it's pretty immediate, because it looks to help solve the GP crisis at the moment. And right now we've got almost 50% of GPs indicating in the next 10 years they'll retire. For 20 years, we've really struggled to train more GPs. They take a lot longer to train as well. And at the moment, I'm without a GP at the moment. I can't get a GP. I've moved and I can't seem to get into a GP clinic. Alongside that, there's a lot of people waiting very long periods of time to get an appointment, sometimes weeks. And so this is a solution now. We've got nurses and registered nurses in the system. They are doing clinical hours already. They could still continue working on our wards and working in our primary health system while training at the same time. We just need to provide them with the funding to do so. So this would mean that we would be upscaling our nursing population, and within a couple of years, they'll be hitting the ground running. Why wait? Would be my question for what is a relatively small investment of money to get the ball rolling.
A plan that wouldn't even cost all that much. Rachel Smalley, thank you for joining us.
Thanks, Maria.